May 14th, 1993 is a date medical investigator Richard Malone and coroner Patricia McFeely would find very hard to forget. They would realize that day that a new killer was present in their area, one that would sicken 24 and kill 12 that spring. To this day, it causes rare and sporadic outbreaks. Originally called Muerto Canyon virus, it was ultimately named Nombre Virus. It is a virus that causes such severe disease and high mortality that people didn't want it associated with a place they called the Canyon of the Dead. Early on the 14th of May, 19-year-old Mr. M was traveling with family down the roads of New Mexico to a very sad and somber event, the funeral of his 21-year-old fiancée, who I'll call Miss F. He was determined to attend the funeral despite having an unrelenting flu-like illness for most of a week. Indeed, on the 11th of May, his fever, chills, and muscle aches were severe enough to bring the otherwise healthy young man to the emergency department. His test results that day were largely normal, but his respiration rate was elevated at 24 and oxygen saturation depressed at 91. Unsure of whether Mr. M had influenza, a bacterial infection, or both, physicians prescribed amantadine and erythromycin. Acetaminophen, Tylenol, was included to lower fever and reduce pain. But on May 13th, he was back in the ED, now experiencing shortness of breath, vomiting, diarrhea, and cough that produced yellow, occasionally blood-tinged sputum. But his lungs sounded normal and he was discharged again. That very next day, May 14th, while on the drive to Miss F's funeral, Mr. M's breathing suddenly got much more labored and ineffective. His relatives pulled into a gas station to call an ambulance. The ambulance crew found him in respiratory failure. He was brought to Gallup Indian Medical Center, but he could not be revived. The physicians called the New Mexico Office of Medical Investigator, and Richard Malone took the call. Dr. Malone immediately recognized that this case was similar to that of a young girl who died several weeks before, so he called Patricia McFeely. Dr. McFeely had done the autopsy on the young girl and determined that the cause of death was respiratory failure due to pulmonary edema. Effectively, she drowned in her own fluids. Her autopsy on Mr. M would also show that his respiratory failure was due to pulmonary edema. To see two cases of respiratory failure in the same area, both caused by pulmonary edema and in people so young and previously free of cardiovascular disease, gave McFeely an ominous feeling. When Malone met Mr. M's family, they spoke of the sadly departed couple. They both were marathon runners, lived together, and had a young baby. When he heard the details of Miss F's death just 5 days earlier, Malone's blood must have run cold. She had been experiencing a flu-like illness for several days, suffering from muscle aches and fever. While being evaluated at a small clinic on the Navajo reservation, her troubled breathing escalated so quickly that there was no time to bring her to a larger, better-equipped facility. She died of respiratory failure. Again, autopsies of the patients showed that the proximate cause of their respiratory failure was pulmonary edema, fundamentally an accumulation of fluid in the lungs. Specifically, they had non-cardiogenic pulmonary edema. Their hearts showed no abnormalities. The source of the fluids was the pulmonary capillaries. They suffered a loss in integrity and leaked massive amounts of fluid into the interstitial space, the space between the capillary walls and the cells that make up the alveoli. For proper rapid exchange of oxygen and carbon dioxide to occur in the lungs, the distance between the alveolar space and the red cells in the capillaries must be as short as possible. To accomplish this, the cells of the alveoli and the capillaries are squamous epithelial cells, which have a flattened or squashed profile. The space between these cells, the interstitial space, labeled IS in these photographs, is exceedingly thin. But in these patients, fluid leaked into the space, expanding it. With a greater distance to move, carbon dioxide and oxygen exchange was dramatically reduced. the patients began to suffocate. The ultimate root cause of the disease would be discovered in a very short time, and it would be quite surprising. On Friday, May 28th, New Mexico made an official request to the CDC for assistance. On Tuesday, June 1st, a CDC team of 15 individuals were present on site collecting blood and tissue from patients and the deceased and reviewing medical records back to January 1st. The tissue and blood samples were flown to Atlanta for analysis at the CDC Special Pathogens Branch, which by June 4th isolated IgM antibodies from 9 patients and found that they cross-reacted with several types of hantavirus. Hantavirus was not on the usual suspects list. Up until then, it was best known for causing hemorrhagic fever with renal syndrome, HFRS, in Europe and Asia. HFRS is a very serious disease in which increases in vascular permeability lead to fluid accumulation in and around the kidneys. The loss of fluid is so great that the hematocrit, or the concentration of red cells in the blood, increases. The one hantavirus known at the time to be present in the United States was Prospect Hill virus, which was observed in voles in Maryland, but never in humans. By June 10th, only 2 weeks after being invited into New Mexico, the CDC Special Pathogens Branch identified a novel hantavirus, which would become known as the Nombre Virus, meaning virus without a name. The Four Corners mystery disease would be called Hantavirus Pulmonary Syndrome, HPS. Investigators responded to the identification of the virus with widespread trapping of rodents, the common carriers of hantaviruses. By June 17th, the virus was identified in deer mice, Peromyscus maniculatus. The virology and epidemiology were advancing with extraordinary speed. Deer mice can be persistently infected with the Nombre virus, SNV, which is shed in their urine and feces. Infection of humans commonly occurs when people attempt to clean up the mess left by the deer mice. The process of cleaning aerosolizes the virus and easily allows for the infection via inhalation of the airborne virus. The CDC publishes instructions on how to clean up rodent urine and droppings, and I'll provide a link to that page below in the description. SNV, classified in the family Hantavirus, is an enveloped virus with a genome composed of 3 negative-sense single-stranded RNAs. It infects endothelial cells of pulmonary capillaries, but despite robust reproduction in these cells, it has little cytopathic effect. It's actually the immune system that appears to be responsible for the life-threatening pulmonary edema. Indeed, the switch from the flu-like prodrome to the rapidly progressing and often lethal cardiopulmonary phase is coincident with the arrival of T cells on site. The increase in the permeability of the capillaries is massive and very rapid. Hematocrits in the 70s have been observed, and cardiac output decreases due to the insufficiency of blood return to the heart. Physicians have described seeing chest x-rays going from normal to whiteout almost immediately. The trigger appears to be the cytokine IL-6 in HFRS, and it is hypothesized to be so in HPS as well. This opens the possibility that existing and future IL-6 inhibitors might be used as effective treatments of these hantavirus syndromes. Presently, there have been over 800 cases of HPS in the United States and over 100 in Canada. It is currently best known as the disease that killed Betsy Hackman. Since 1993, at least 8 additional hantaviruses have been shown to cause HPS. The most notable of these is our quaravirus, which has caused over 1,000 cases in South America. There are no treatments for hantavirus infections, nor are there vaccines to prevent hantavirus infections. Only supportive care, notably extracorporeal membrane oxygenation, ECMO, is available for the infected. So why did this disease, HPS, come out of nowhere in 1993? Retrospective studies have shown that mice had been infected with the virus prior to this year. The difference? The rain. There was a lot of rain that year, and this resulted in a lot of vegetative growth, and that means the mice had a lot of food. With a lot of food, the population of the mice swelled enormously, and this put them in closer contact with humans. Thank you for watching.